Hey guys, I had someone contact me with a question about a client, sort of limited conditions and what they can do to work with this client. And I wanted to use the email as an example for a video and a blog post because this sort of consumer information, this sort of client care stuff is things we have to deal with all the time. So I got permission to use this from them. I'm going to read this out. The student said, "Hey Robert, I have a new client that wants a Thai massage today. I just noticed it's midnight. She completed her intake form yesterday and stated she has suffered cerebral hemorrhage 38 years ago. Left side got paralyzed and stiff. She exercises, but she has limitations due to stiffness. On one part of the intake and how she responded, it said, please describe your pain and if it is always present or just when you do a certain activity. Please describe the activity. Is it stabbing, aching, burning? And they said, my left arm, the shoulder, when I stretch. My left leg around the hip joint when I bend." This student then said, I obviously need to discuss with her about her limitations and keeping an open dialogue throughout the session. Should I keep away from some stretches or ultimately leave it up to the client and what she can handle? So, I'm going to break this into sections and how I would normally deal with this with a client. One, they're filling out the intake form. They had a cerebral hemorrhage 38 years ago, so they've lived with this, the bulk of their life. The left side got paralyzed and stiff, and it sounds like she exercises, but there are limitations just based on general stiffness. And they said that their left arm at the shoulder joint when they stretch, which I'm assuming means some sort of range of motion through the shoulder joint, is problematic. And the left leg around the hip joint when they bend, which I assume means bend at the waist. The student talked about the fact that she needed to discuss with the client their limitations, keep an open dialogue throughout the session. And I think that's the key. You really have to judge it based on what a client is going to be able to deal with. When the student asks about keeping away from some stretches or ultimately leaving up to the client and what she can handle, I don't typically think so much in terms of stretching. Now, when I say that, that doesn't mean I don't mobilize people. What I'm saying is, what's the difference between a stretch and mobilization? If I take someone and they're very stiff through their shoulder joint, they don't necessarily have adhesive capsulitis. They just have a very limited range of motion. Now, where is that limited range of motion coming from? Is it coming from soft tissue or is it a bony issue? Maybe they know from a doctor, maybe they've had scans. If it is a soft tissue problem, we as body workers and massage therapists are uniquely poised to be able to help people with that. If it's not a soft tissue issue, then is it bony structure? Is it ligaments, tendons? Is it some other, do they have bone spurs? There's all this stuff that's really not within our scope. If somebody had a bone spur, what can we do about it as massage therapists? We can work the tissue around the joint, but that's about it. Mostly what I see in clinical practice is the following. A lot of what you think of as a contraindication is a caution when you understand what you're working with. Now, I'm not going to force someone who's having a shoulder problem into a range of motion that hurts them. If they go, oh, okay, I can go about there, but I can't go any higher. I'll go, okay, Cal, can you lift your arm up? And if they go, oh yeah, it's right there, but no higher. Okay, so I'm just getting some information about their range of motion. I'm making judgments about rotator cuff muscles and what may be going on just based on observation and then on palpation. I'm going to communicate with that client in great detail, especially because they have a health issue. And if they're having a soft tissue problem, they may be exquisitely tender in some of the tissue that I'm going to be working on. It's not about the pressure applied. It's not about the depth of the pressure applied. It's not about whether it's Thai or it's deep tissue. We just work soft tissue. I have to communicate with that person more. Now, let's say they did have bone spurs. Let's say that's the fundamental issue. Well, one, they need to see a doctor for that. 2, can we help with pain related to soft tissue that's essentially stacked on top of the bone spur? They've had a bone spur for a while. It hurts. I'm just using this as an example, by the way. I don't know if I've ever run into bone spurs in the shoulder joint specifically. But when they move their arm, it hurts because of the bone spur. But then the muscles begin to tighten up to limit range of motion because they don't want to injure the joint anymore. That's what it seems to be happening in my clinical experience. If they have pain and they're at a 7, the bone spur might only be like a 3 or a 4. I can take away 2 to 3 points on a pain scale of their pain and give them a better quality of life, hopefully a higher range of motion, not having done anything to that core issue, which is the bone spur that's out of our scope. When you're dealing with pain in clients, you need to do more research. You need to find out what they're dealing with. You need to find out if they have copies of their scans. You need to ask them what the doctor told them is the problem. There are certain things that are certainly out of our scope. Beyond that, we as body workers have to learn along with our clients. I'll give you another example. I do abdominal work. The abdominal work can be very deep. I've worked with women, and the women will report to me that their menstrual cramps improve tremendously. They're just completely blown away at how, something they didn't think massage could help with. Like, massage can help with menstrual cramps? And it's like, well, in some cases, I do find in my clinical experience that some women will get benefit from their menstrual cramps. Great cessation of pain, a much easier cycle. And then I will say, but I'm not exactly sure of the mechanism. And then I can even go into a little bit more detail about smooth muscle tissue, skeletal muscle, and smooth muscle tissue is stuff like your digestive tract. It's not voluntary. It's not like my bicep where I tell my bicep to contract. That's skeletal muscle. So I bring the clients along with me into my question. When I do that, the clients don't lack respect for me. They actually respect me more. This is what I find. They actually respect that I'm giving them information, giving them as much as I have. And in my case, because I'm a guy, I say, listen, Mary, I just worked with you on your menstrual cramps. I'm really glad that you got some help and benefit from that, but I've never had a menstrual cycle. I need to work with you in an ongoing way to get you to teach me about those things as a woman, because I'm going to deal with other women who are having similar issues. That sort of open dialogue, open feedback creates a situation where I'm on a level with the clients. I'm not superior to them looking down at their soft tissue dysfunction. I'm actively communicating with them as a colleague in their own session, in their own experience of the body work that we're doing. And I find that I actually get more mileage out of that by asking questions, by being receptive and open, giving them an idea of what I think it might be, and then sort of walking them through a rebooking process, which means this young lady, she's having a problem with her shoulder, arm stiffness. Am I going to stretch her to end range? No. But am I going to gently mobilize? Am I going to palpate and feel for tissue and go, ooh, what's up with your bicep and the deltoid right here, this connection? Oh, okay, what's going on with your coracobrachialis? All right, what's up? Ooh, your tricep. In the back, ooh, your rotator cuff, your infraspinatus. I'm going to slowly work through that area to see if I think that soft tissue is a component. Now, was there any extreme stretching? Extreme, like range of motion, end range. Oh, I can't bend my shoulder back anymore. Right. Oh, it's like Brazilian Jiu-Jitsu. I can't rotate that joint past a certain point. That's what we're dealing with. Putting somebody through a gentle range of motion is not bringing them to end range. When I think of stretching, that's often what stretching is on Instagram. It's flashy in yoga poses. It's maybe flashy in body work sometimes, but I get much more benefit out of, are you ready? I'm a time massage teacher, right, in the United States. I spend more time compressing. I spend more time palpating and stretching skin than I do stretching people. And in fact, if someone had a horrible rotator cuff problem, 9 times out of 10, if I mobilize them and stretch this, I would get no benefit for that client. But if I test their range of motion, apply some compression with shear, work on several muscle groups, and then back off and test the range of motion again, the range of motion increases. I hope that gives you a little bit of information about how to deal with some of these situations. I want you to understand that even though we talk about Thai massage and stretching, most of the time it's a gentle mobilization to test the range of motion, comfortable range of motion, and then I'm going to apply some sort of soft tissue technique. It's not really stretching, even though that's what's visually what you can see on camera, if that makes sense. I hope that gives you a little bit of information about how to work with clients, about how I work with clients. I spend much more time mobilizing someone to put them in a position to be able to deliver some sort of skin stretch than I do actually stretching people. Stretching has very limited effects and very limited benefit in my experience. Now, that doesn't mean I don't stretch. I'm also a yoga teacher. I'm just saying that it has a limited benefit. I actually find that the palpation, the actual hands-on touch, bodywork, manual therapy, the manipulation of soft tissue is actually far more beneficial, but I don't really choose. I use a little bit of both. Typically, I'm going from a mobilization to some sort of compression and back and forth. When you're dealing with pain, the bottom line is this. Most of those contraindications are cautions once you've done your research. What's the potential for harm? What's the potential for benefit? And when the potential for harm is exceedingly low, but the potential for benefit is extremely high, communicate more and work on people in chronic pain. I am a dedicated manual therapist. I work on chronic pain in people, and it is amazing to me. When I say the sheer scale of what I see in clinical practice, it's like walking into the Pacific Ocean. That much pain exists just from soft tissue. The stuff that we as manual therapists, as massage therapists can deal with. Huge, just vast amounts of pain that's just coming from soft tissue. It's not a medical issue per se. It's not a surgical issue. It's not something people need necessarily medications for. But manual therapy helps people a huge degree with lots of chronic pain that people are walking around in day to day. I hope this video gives you a little bit of benefit, and I'll talk to you guys soon. As always, if you have any questions for me, feel free to contact me. I'm happy to answer your questions, and you can email me, robert@robertgardnerwellness.com.